One of the things we're all trying to figure out is the timeline. That is probably singularly for business owners, for the health of the country, for everybody trying to figure out what does this timeline look like. We've heard the president talk about Easter. We've also heard people in his administration saying that each curve, which is local, could last somewhere between 8 and 10 weeks. How do you see this playing out, just so we understand?
Yes. So the best, I think, analogy we have, or the best place to look, is what happened in China with imposition of physical distancing and quarantine. And if you look at their curves, they implemented this roughly at the end of January, the last week of January. And over the last few days, they've announced no new cases of COVID-19. So that gives you an 8-week curve. These curves, for those of your viewers who have looked, they're symmetrical. As they go up, they come down. They're sort of bell-shaped curves. And so you can, I think the 8 to 10 week time period is probably right. But that assumes something very important, which Meg got to, which is we have to have a coordinated national effort. This patchwork, which I've been decrying for 3 weeks now, is actually undermining the efforts. States that are imposing the stay-at-home orders, the quarantines, if other states aren't, they're not getting the maximal benefit from a public health standpoint of those stay-at-home orders, and they're receiving all the economic pain. We need a national effort. It has to last 8 to 10 weeks or so, and then during that time, we need to have testing ramped up massively, but also we need to have contact tracing, something that they did in South Korea, so that if a case does pop up after we begin to slowly release the stay-at-home orders, we can actually identify and isolate those cases so we don't have a big outbreak. Those are the kinds of actions we need. Yes?
Zeke, the thing I'm trying to understand is, let's say New York is 2 to 3 weeks away from its peak, and therefore there would be another 3 or 4 weeks on the other side of that. If at the same time we have this rolling across the country with the possibility that people could travel back into other states like New York that might have been on the other end of that peak, how long does this go on for? If we aren't going to do a full national lockdown, 30-day shutdown, if we have this conversation in September, what will we be talking about?
Well, if we don't do a full national shutdown and we actually allow different states to go different ways, and you have Mississippi allowing everyone to gather, you are going to have just these roller coasters where we contain it in some area, then we try to ease it up, and it just blossoms again. And we are never going to get it under control in the whole country. We're going to see, call it a third of the population, and that's a very, very conservative estimate, infected with COVID. And even if we have a low death rate, kind of on the par with South Korea, that's a million people dying. Let me remind you, that's twice as many deaths as from cancer in the entire country. I think, many of these people who say, well, we just should let states go, don't appreciate how the magnitude of this problem.
Zeke, but also speak to this, because we've talked about this a lot with you over time.
Yes.
Some people say that the cure is worth more, or the cost is worth more than the cure. The cure is worth more. That basically doing what we're doing is going to be so economically damaging, and that's going to create its own health crisis over time. You've talked about what to do over the age of, I believe, 75, if I remember. How do you think about that trade-off? I mean, this is a bit of a moral and economic trade-off that's taking place here.
It's absolutely. But I think if we do 8 to 10 weeks now nationally, then slowly ease up, I think we can get to the sweet spot in between. If you do this patchwork, let's just say in September, are we going to have any big conferences everyone's going to attend? No. Are you going to have a lot more travel to Disney World or Disneyland? No. Are you going to have restaurants open? They might open for a little bit, and then COVID explodes and they'll have to close back down. I think that is much more uncertain, much more of a roller coaster. And in that roller coaster, which I predicted, I wrote about a couple of weeks ago, if we don't do a national implementation, we will not be able to get the economy going. It'll be in fits and starts, and it will not solve the problem. I totally am sympathetic to you. 10 weeks of quarantines with physical distancing is a big imposition on the economy. But the alternative is we actually do not get going. We don't actually open up the economy, because every time we open it up, we get this blossom of cases, this overwhelming number of deaths, and overwhelming of the health system. Yeah,
Doctor, the heartbreaking situation that we've seen in Italy, where doctors need to choose. Let's go back and please drill down ethically on your real view on this and whether it's changed, because you told us a couple of times that people over 75 should stop getting treatment. They shouldn't. We shouldn't be wasting the resources of the. Okay.
No, you are totally.
Okay,
you are
how
totally
have you modified?
No, it's not that I've modified. You totally misquoted me, and I really object to that.
What did you say?
What I said, that article was not a policy article. That article was a personal reflection, my view of my life. And I said explicitly in that article, this isn't a policy recommendation. I don't say cut off Medicare at 75. That's something Lieutenant Governor Patrick of Texas seems to be saying. Right. No, my view is.
What did you say
actually,
in person?
That's a personal view. If a person says, listen, I don't want medical intervention after 75. I don't want to be intubated if I get COVID. I totally respect that. And that would be my position. I'm not saying that's a national policy. That's a personal position. And we should ask every person to think deeply. Do they want to be intubated if they got COVID? I totally agree with that. And that's not a national policy. The national policy has to be, we provide health care to everyone, and we want to save everyone's life if they want it. Okay? That's my position. So I would really appreciate you quoting me correctly and not.
We had long discussions on it. I didn't know that you made it personally. I mean, personally, I didn't agree myself, and I hope I lived about 100.
I'll send you the article. I'll send you the article.
No, I believe you, but I just disagree personally that I would do that as well. We all want to live as long as we can, and I think we can be useful.
That's one of the great things about America. We can have a disagreement, but the policy allows you to do what you want and me to do what I want.